My name is Robin Clayton, RN, and this is Emily Higginbotham. She has provided verbal consent to portray my patient for this video assessment. Today I'm going to be assessing her hearing in her ears and her nose and her sense of smell. I'm going to start with cleaning my hands first. And then I'm going to go ahead and put on gloves. Emily is 24 years old. She has no allergies. She has a past medical history of pre-diabetes. Emily, we're going to start with getting your weight to start with, okay?
Okay.
So you can go ahead and step down. I'm going to get my scale turned on. All right, you can go ahead and step up. All right, great. You can step down and have a seat back up here. And next I'm going to go ahead and get her blood pressure real quick and her other vitals. Alright, if you will just straighten this arm out for me. Alright, your blood pressure was good, 110/72. And let me check your pulse real quick. Alright, your pulse is normal at 60. Put this under your tongue. All right, 97.9. All right. So I'm going to start with looking at your ears, okay?
Okay.
Have you had any ear pain recently?
No.
Any drainage or anything like that?
No.
All right. So do this side first. All right, and when I'm looking in her ear, I'm pulling this part up and kind of to the back, just so I can get a good view of her eardrum. There's no redness, no bulging, nothing like that on that side. Just gonna stretch this over. And do the same thing on this side. Alright, everything looks good. Alright, next I'm going to check your hearing in several different ways, okay? I'm going to stand behind you and I'm going to rub my fingers together, okay? And when you hear that noise, I just want you to raise your hand, okay? Alright. Alright. Next, I want you to close your eyes and just relax. And I want you to push in this part of your ear, okay? That's called the tragus. And I'm going to whisper a series of words, and I want you to repeat those back to me, okay? Dog, cat, table.
Dog, cat, table.
All right, perfect. Next, and I would do that on the other side, but logistically, it's difficult to get behind her right ear. Next, I'm going to use the tuning fork. And I'm just going to get back over on this side. And I'm going to hold this a few inches behind your ear.
Mm-hmm.
I just want you to raise your hand when you hear it, okay?
Okay.
All right. Perfect. And now I'm going to do the same thing, but I'm going to hold this on the top of your head right here, okay?
Okay.
And I just want you to tell me if you hear it the same on each side, okay?
Okay. Yes.
All right, perfect. So that is the end of assessing her ears. Next, I'm going to assess her nose, okay? if you'll just take your glasses off for
Okay.
me. So I'm just gonna visually inspect her nose. Everything looks fine. I don't see like any breaks in the skin, any swelling. Have you had like any nosebleeds or pain or anything?
No.
All right, I'm just gonna feel your nose. Does that feel okay?
Yeah.
Any pain up here?
No.
All right. I'm gonna get you to lean your head back. I'm just gonna shine a light in your nose, okay? All right. And I'm just checking for any redness, any blood, swelling, drainage, anything like that. Everything looks fine.
Okay.
The last part of the exam is I'm going to check your sense of smell. So what I want you to do, I want you to close your eyes, and I'm going to pass a couple of samples under your nose one by one.
Okay.
And I want you to tell me what you smell, okay?
All right.
All right. That's the first sample.
Alcohol.
All right. And the second sample.
Spearmint.
All right. And that concludes my assessment of Emily's hearing in her ears and her nose and her sense of smell.